We categorize different areas into green zones, meaning less than 5% positivity rate, yellow zones, 5 to 10% positivity rate, and red zones, greater than 10% positivity rate. You have 3 counties in Georgia that comprise about 25% of the cases, Fulton, Gwinnett, and Cobb County, but the state of Georgia is in a yellow to red zone for positivity, between 9 and 11%, depending on which study you look at. And that's why we need everyone to embrace basic public health measures. My 3 W's: wearing a mask, washing your hands, and watching your distance, meaning stay 6 feet or more away from others. But as it pertains to those studies, we also want people to understand that younger people are at lower risk for having severe complications from the virus. The flip side is that they are the majority in many communities of our asymptomatic spreaders. They're the people who don't have symptoms, who feel and look fine, but who are spreading disease in the community. And it's inevitably ending up in nursing homes and ending up infecting vulnerable people who then could go on to die from this. So we want you to understand that even if you feel like you're not at high risk, you could still be spreading the disease in your community. You could still be the cause of someone else dying, which I know no one would want. But you're also the cause of us not being able to reopen, because the biggest impediment to reopening, and the reason why schools that are trying to reopen are closing and churches can't be open and we can't have sports as much as we would like to, is because of background community transmission rates. We like to drive down viral transmission as much as possible. We consider less than 5% positivity rates as being in the green zone and being the safest environment for reopening. When you're in the yellow zone, that's just like a stoplight. That's caution. You need to pay attention to where you are. When you're in the red zone, you need to be considering whether or not you should be shutting down certain places. And again, when you look at Fulton, Gwinnett, and Cobb counties, and some of the other places in Georgia that are clearly over 10% positivity rates, we need to be looking at things like limiting indoor gatherings, limiting the number of people who are going inside the restaurants, perhaps closing down the bars early, because we know that's where a lot of spread occurs. And certainly for young people going back to school, avoiding frat parties and college parties, which again can be hotbeds for spread of a contagious disease like COVID-19. The good news is that when you look at Arizona, for instance, Arizona was in the red zone and was in really bad shape a couple of weeks ago, but they really buckled down on the 3 W's: wearing a mask, washing your hands, and watching your distance. And they were able to, in the course of about 2 to 3 weeks, really turn around their case trajectory. I was in Georgia with the governor just last week, and we opened up a new testing site there, which I think will increase visibility as to who has the virus and who can be asymptomatic carriers. And we've seen that that has had some success in helping people know when to isolate and quarantine. And again, we're starting to see the numbers level off and come down in Georgia. Things are going in the right direction, but we need people to stay vigilant, to make sure they're wearing a mask and watching their distance, especially, and doing what your mother always told you: wash your hands.
Mm-hmm. You talked about this being politicized. Do you really think the media did it all, though?
I don't blame it on the media. I blame it's really all of us. There's not a page in the pandemic playbook for a presidential election, or for an impeachment trial, or for a major social justice movement. And I think whether it's the media or whether it's us, we need to resist the temptation to frame health information through a political lens, because the country is divided. And if you frame health information through a political lens, and in terms of who you should or you should not vote for, then you're going to be turning off half of the people out there. And as Surgeon General, my job isn't to be the Surgeon General for Democrats or Republicans or one party or the other. It's to be the Surgeon General for the United States. And hence my plea to keep the politics out of discussions on health, and to people out there to understand that when I'm saying something to you, I'm saying it to you because it's what the best evidence recommends at this point in time.